Good Friday afternoon to all of you. It's Wynn Brown from Heywood Healthcare. Just as we get to the end of the day, as you can see, the sun is setting just in the distance. That's why I've got my nice Bates baseball cap on to try to give me a little shade as I try to read my notes to you on today, Friday, the 29th of January. Hard to believe that on Monday morning we will be in February and we will be going live with our new electronic medical record called Expanse that we have worked 3 years to bring online and have a state-of-the-art single electronic medical record for our 2 hospitals and our Heywood Medical Group. And so huge lift going on over the weekend and into Monday morning. And so just a big shout out to everybody for the great work we're doing. I know everybody's like nervous and excited at the same time. It's kind of like Christmas, but you don't know what the present's going to be. It's going to be very busy Monday morning as we bring that up online, and it'll definitely settle down as we come into the week. If it takes a little longer, if you're a patient, to get you registered or a little more time at a medical practice, please just bear with us. In the end, we're going to have something awesome that is just great for our community and for our staff. So thank you to everybody. I know everybody's anxious to know how's our testing going because it's been relatively high as of late, as has been our inpatient volume. So just to let you know, since the start of the pandemic at Heywood, we have done 56,437 tests. Think about that, just COVID-19 tests at Heywood. And that also includes the testing that we do at Tully as well in our urgent care center. So that is amazing. Our 7-day rolling average has come down a little tiny bit, about 20 basis points to 7.32%. versus the state at 4.44%. So relatively stable, but coming down a little bit. And if we look in our region, we get information every day from the Central Mass hospitals, and we have peaked a little bit and coming down nicely on the overall inpatients. And you'll see that in our numbers overall, not necessarily today because we have 25 COVID positive inpatients in the system, 5 in our ICU, but remember, we hit 30 a little over a week ago, so we are down a little bit right now. And you can see that on the chart that's embedded here, as well as the averages for the towns in our service area, and you can take a look at that. I know that we talked on Wednesday, there's huge crush of want for information around availability of COVID vaccines as we enter phase 2 on Monday. And as I told you, we are working to put up a regional testing center. We really don't have much vaccine in hand at the moment. And so we are waiting to hear from the state what our type of allocation we will have, working with the local boards of health to put all that together. But just know what we put together and when we get a green light from the state along with vaccine. And if you're watching the national news, you're hearing about there's going to be a bit of a shortage as we come through the bit of through February. So we're going to do everything we can to serve the community. We will put that information out, so you don't need to call community relations or your local practice, physician practice, to find out when and where you can get it. You can go online, look on the state website. I know some people are going out of region to get it, and that's perfectly fine, or going to Walgreens or CVS where they can get it. But again, we just don't have that much on hand. We are doing a small clinic on Monday, largely for phase 1 people. So, people who are working directly with patients to get that done. But as soon as we have some information and some access, we will let you know. I encourage you just to follow us on Facebook in particular to get the information you need from us. You can also go to heywood.org and atholhospital.org. We also have Instagram, Twitter, and LinkedIn accounts as well. So we are out there on social media, so please take a look. The Baker-Polito administration had an update today on the pandemic, so please, there's a link there for you. A shout out for our local chamber, which does great work. It's super raffle tickets are available, and the drawing is Wednesday, February 24th. You don't need to be present to win, and the information is there of how you can buy a ticket or go in with a group to buy a ticket. Also, a lot of the community members, as we've talked about, we love the notes that come in. I have some here just to close out today's broadcast, I guess, if that's what we want to call my 3 times a week updates for you. There is a Valentine's tree in the Heywood main lobby if you want to drop off a note so that we can share those with staff. That would be great. And and you can send those messages also to Community Relations at 242 Green Street, Gardner, 01440. So to close out with some kind words of gratitude from our community, four notes. Thank you, Heywood Hospital, for all your hard work. You guys are amazing. A little heart emoji. Thank you. Kindest, most compassionate doctor I've had the pleasure to meet. Brilliant and dedicated, Dr. Sheila Donnelly, who's our chief of oncology, who is simply amazing. Oh, happy tears. Such a great positive story. Oh, to hear the thankfulness in his voice. You healthcare workers really are heroes. There's been nothing easy about your job. So happy to get to see small victories. Thank you for all you do. Twice during the pandemic, I brought my niece to the ER for leg injuries. Both times we were in and out. One of the nurses actually remembered her from the first time. I thank you for all your hard work keeping up with the mess we're in. Keep up the good work and stay safe. So some nice words of gratitude from our community to our caregivers and everyone across the Heywood healthcare system as we strive to be one of the best community-owned health systems in America. Have a great weekend and stay tuned on Monday morning as we bring our new electronic medical record called Expanse live. Take care.